Are you suffering from excessive bleeding during menstruation or pain during menstruation? There is a possibility that you have a fibroid uterus. Hello friends, I am Dr. Pavan Gulhane from Medigrace Hospital and INA IVF Center, and today we will be discussing about symptomatology, their diagnosis and treatment of fibroids. Do you know, if we do ultrasonography of women between 15 to 40 years of age, then out of 100 women, there is a possibility that we might see fibroids in 35 to 40 women. But do we see the problems of fibroids so often? No, obviously not. Because not all the fibroids are symptomatic, and that's why fibroids are more difficult to diagnose. So let's know how the fibroids are formed inside the uterus. There are many patients who ask me that I have fibroids and my sister does not have. Because the fibroids are formed by the genetic influence on the myometrial and fibrous cells in the uterus, which is under the influence of estrogen will form a mass which is called as fibroid. So fibroid is not necessary that every sibling is going to have a fibroid. If you have 3 sisters and all 3 sisters will have fibroid, that is not necessary. We generally see fibroids in the age group of 15 to 45 years of age, because the fibroids are formed by the estrogen which is secreted by the active ovaries, and ovaries are activated at puberty at the age of 15 and till the menopause till the age of 50. Now let's know what are the symptoms that fibroid can cause. The major thing to know about the fibroid is fibroid mostly does not cause any symptoms. If the fibroid is lying outside the uterus, that is called subserosal fibroid, then mostly fibroids are asymptomatic, that fibroids will not produce any symptoms till the time it becomes very big. Last week we operated 2 patients with a fibroid as big as 15 centimeters of size, and patient did not have any symptoms. But when the fibroid is lying inside the wall of the uterus or inside the uterine cavity, that is a fibroid polyp, these fibroids are the ones who are going to cause symptoms, and probably patient will reach to their doctors early and the diagnosed early. So the symptoms are, if the fibroid is there in the myometrium or the endometrium, that is subendometrial fibroid or intramyometrial fibroid, patient will have severe pain during menstruation, patient will complain of more quantity of the menstrual blood during the menses, or the menses will delay for longer period of time. The normal time for the menses is 2 to 8 days, and if your menses are prolonging more than 8 days, then definitely you have menorrhagia and the cause has to be searched. Other symptoms are, you might have spotting between 2 menses. It is called metrorrhagia, and if you have spotting, there is a possibility you might be having fibroid polyps. Other symptoms are because of the size of the fibroid, and that is, if there is a pressure on the rectum, then you will feel like incomplete evacuation of the stools, or if it is on the bladder, you will feel like incomplete evacuation of the urine, and you might have increased frequency of micturition. And one more symptom that fibroid patient do have is infertility. If the fibroid is more than 4 cm in size and it is lying in the myometrium or submucosal, it is definitely will cause infertility in the patients. Now, after knowing all the causes, the symptomatology, let's know how do we diagnose the fibroids. Fibroids are best diagnosed with the sonography. It can be transvaginal sonography or by the abdominal sonography. Other diagnostic modalities are MRI, CT scan, where you can see if the fibroids are larger in size, whether it is compressing on the rectum or ureters or urinary bladder. There is a possibility that patient might have more than one fibroid in the uterus, and that also can be diagnosed on MRI. So now, what are the treatment options that we have for fibroid patients? So for treatment, there is a conservative line of management and a surgical line of management. Not all the patients of fibroid are going to require treatment. If you have a fibroid of even 6-7 centimeter size and it is not causing you any symptoms, there is a possibility that doctor might advise you not to undergo any treatment. So if you have bleeding because of the fibroid, doctor will give you some medicine that will reduce the bleeding. There is a possibility that doctor might give you hormonal management for reduction in the size of the fibroid and reduction in the bleeding. If you have pain because of the fibroid, you will be given analgesics in the form of routine analgesics. There are also newer form of modalities, treatment modalities are available for the fibroid, and those are few tablets that can be given to reduce the size of the fibroid. We can also give GnRH agonist injections which will reduce the size of the fibroid. There is also one more modality, that is uterine artery embolization, that is done by the radiologist, and that will shrink the size of the fibroid. The only problem with all these modalities is once the effect of these modalities are waned off, the fibroid will grow back to its normal size. So now we come to the surgical part. So surgically Typically, fibroids are removed by hysteroscopy and laparoscopy. If you want to know more about the hysteroscopy and laparoscopy, we have already talked about it in the previous video. The link is given in the description. If the fibroid is smaller than 3 cm and it is inside the uterine cavity, that is submucosal fibroid, these fibroids can be removed by hysteroscopy without giving any incision on the abdomen, which is called resectoscopy. If fibroids are larger in size, they will be removed by laparoscopy. There is one more myth about the fibroid removal by laparoscopic technique in patients, is that if the large fibroids can be delivered out with the laparoscopy. We have a specialized gadget that is called as morcellator, and with this morcellator we can remove as big as 15-16 cm fibroids out of the abdomen with a small incision on the tummy. I hope I have solved all your queries regarding the fibroid in this video. If you got some value out of this video, you can always follow us on our social media handle. And if you have any other query about fibroid uterus or any such topics, you can always DM us on our Instagram. So thank you so much. I am Dr. Pavan Gulhane from Medigrace Hospital and Inaya IVF. See you in the next video.